guys, welcome back to Empower.RN. So I'm responding to a video request from Misha Snowy, who asked me, can I do a video on how I present myself as a nurse? I mean like hair and makeup style. So for sure I can do that. So the first thing that I want to do is I want to talk about the uniform. This is one of the uniforms that I wear at one of the hospitals that I go to. It's royal blue scrubs. The brand didn't matter, just the color. Actually, one hospital that I went to, it did matter. You had to wear Cherokee, the brand, and royal blue. But anyways, when I was at a hospital that was rolling out the mandatory uniforms, I saw a lot of resistance from the nursing staff, and I didn't really understand why. Personally, I think it looks better when you walk into a hospital and you can clearly see who the nurses are and who the doctors are, and everyone, it looks more uniform and, you know, looks more professional. And guys, we are providing patient care, so if I'm going somewhere and, you know, it were my mother being treated, and I would want it to be more professional. So I don't think it's a bad idea. Plus, it's less to think about. And think about it like this: if somebody's willing to pay you and they just want you to look a certain way, well, whatever. Just wear what they want to wear, and on your days off, you can wear whatever you want to wear. So, the first thing that we can really focus on is our hair. How we wear our hair is pretty important. I personally, now that I've been a nurse for 5 years, I do always wear my hair up. And that's for a few reasons. I just think it looks more professional. And I usually do style it though. I will curl a little bit in the front, maybe even a few curls. I don't know if you can see that. But I will put a little bit of emphasis into it. I don't just put it up and forget about it. But I think I do want it to look pretty, so I do put a little hairspray, a little bit of, you know, stuff into it. But I do always wear it up. I see a lot of nurses that do wear it down, and to be honest with you, if you have the type of hair that does look good down all day and you don't have to do much to it, that's fine. But I would encourage you to carry a clip with you at all times, because at any minute you may need to put it up, because if you have to put in a Foley, or if you have to start an IV, or if you have to do something where you kind of have to be physically in the procedure, then you're not going to want your hair to get in the way. So I would encourage you to carry a clip with you at all times. The other thing is makeup. So I think makeup, I personally wear makeup every day. I love it. It's actually my little morning routine to kind of make myself look, I think, pretty for work. But I do keep it light and I keep it simple, and I always want it to look really professional. So the only things that I really do are a little bit of foundation, powder, eye makeup, and mascara. And I think that it just gives me that extra kind of boost of confidence, and it still looks professional, and, you know, it makes me feel good. So I do wear makeup to work. The other thing is jewelry. Please stay with the studs, guys. I see a lot of nurses wearing long earrings, and I've seen long earrings I have seen people have their earrings pulled and actually have injuries from that. So it is required. I mean, if you go through orientation, they will tell you to only wear stud earrings. And just from personal experience, I never wear anything but stud earrings. I do, on my days off, have the longest earrings from BB that you could ever imagine. So, you know, I love long earrings, but I'm not going to wear them to work because I've seen bad things happen. The other thing is nail polish. With nail polish, I believe that in most places you're allowed to wear nail polish as long as it's clean and intact. And so I always wear nail polish. With color though, I think you kind of want to consider your patient population. For me, I work in a telemed-surg floor, so I have a lot of patients between the ages of 60 to 100. So, you know, if I were giving care to my grandmother, I kind of, you know, would put myself in her position and, you know, think of colors that may be appropriate for her to perceive. And so for me, I always just keep it either red, pinks, neutrals, and so that, you know, I don't offend anybody. I think maybe if you were working for like teenagers, maybe if you're like I don't know if there's such a thing as like a teenage oncology unit or something like that, maybe black is appropriate, you know, I don't know. I personally stay away from that color. Also, I see a lot of nurses wearing green or blue. You know, I don't know, I stay away from colors that are not, you know, the norm. but that's a personal opinion, and you know, you guys can just see what works for you. But always just remember that you really want your patients to feel comfortable, and that should be your, you know, most important goal with your appearance at work. So the last thing was, I want to encourage you to put time, energy, and effort to your appearance, because it does make you feel better. I wake up and you know, I put the love, time, energy, and effort into looking the way I want to look, and it makes me feel better when I'm at work. It helps me feel more confident, and you know, I want to encourage you to do that. So looking good, looking pretty, looking handsome, looking professional, it'll just help you come across as a professional, the professional that you are. So anyways, guys, I love you, and please subscribe to my channel and look good for work. All right, love you. Bye.